Welcome to Let's Talk, a new season of our award-winning series of podcasts produced and presented by Hazel and Betty Ford. I'm your host, William C. Moyers. We are glad you've joined us. Today our topic is the intersection between trauma and addiction and recovery from both. Dr. Stephanie Covington is a skilled clinician, an insightful author, and an engaging public speaker, and our guest today. I've had the opportunity to hear Dr. Covington lecture several times over the years, but this is the first time I've ever had the honor of interviewing her. Thank you, Stephanie, for joining us today.
Glad to be here, Bill. Thank you.
And I got to ask you right off the bat, what is your interest in addiction and trauma and the intersection? Where does that come from?
Well, initially, my interest in addiction came from my own experience. I'm a recovering woman, and early in my recovery, I thought to myself, I wish one other woman could feel the way I do. And a series of events led me into the addiction field, and particularly focusing on women. And as I did that, I realized so many of the women I was seeing, either in group in a treatment center or in a private practice I had trauma histories. And I realized nobody was talking about that. And I began to explore it more. And it was the evolution of my work, really. And in those days, and now I'm talking about in the 80s, the addiction field did not want to talk about trauma. I mean, I can't even tell you the negative pushback I got. It was fairly powerful. And the mantra in the addiction field was, when you're clean and sober, you have a trauma history, you can deal with it a year from now, get a year of recovery and then deal with it. And I knew many people were never going to get a year of recovery.
I want to come back to that in a couple of minutes. Let me ask you first, though, can you define trauma for us?
Sure. Well, there are various definitions of trauma. I mean, the one that mental health providers use in the diagnostic manual is that it's really a life-threatening event. And it's a life-threatening event in which can occur because you experience it or you witness or you hear about it happening to somebody else, or you get it because you're surrounded by trauma. And then there has to be a particular response. And the response, it has to impact your relationships and your work life. And so it's not just an event, but it's a person's response. I think a simpler definition would be it's an overwhelming event that overwhelms a person's capacity to cope. Their physical and psychological coping skills aren't working because of the overwhelming nature of the event.
Why then has it taken us so long as professionals in the field to recognize the impact that trauma can have and how it is so intimately connected to substance use disorder?
You know, I've wondered that. I think it's a couple of things. I think one piece has to do with how the addiction field has evolved. You know, it evolved through people with lived experience and people who are paraprofessionals, and dealing with trauma seems kind of scary if you haven't been trained. I think also the belief that addiction is the primary issue, as though that's the only issue. I think that theory has been problematic. And I think many people working in the field had trauma histories they'd never addressed themselves. And so it's pretty scary to think about working on trauma if that's part of your experience and the only way you've managed it is to wall it off. So I think those are the things that have kept us as a field from being willing to really look at this and how important it is to understand this in terms of a person's recovery.
And does trauma affect women the same way it affects men, the same way it affects children?
Well, it affects individuals differently. I think if we talk about women, there's certain traumas that women are more at risk of experiencing. Interpersonal violence, the violence that happens in relationships, women are at greater risk of experiencing than men are. The other thing, for men, there's a different level of shame for men. And I think it has to do with male socialization, where we teach boys that you're supposed to be tough, you're supposed to withstand things, you're not supposed to show your feelings, all these things. And then what if I'm a kid and I'm abused and I feel overwhelmed and I want to cry? Does that mean I'm not a man? So I think it's a different level of shame for men. And for children, part of the challenge for children is trauma impacts the brain. And for a child, their brain is still in development. So the impact on children, particularly in terms of the brain, is really dramatic compared to what might happen to someone who is an adult. So there are different ways that it can impact people differently.
If somebody is impacted by trauma, either currently in their life or in their past, is it assumed that they're going to develop a problem with substances?
Not necessarily. I mean, it's not a guarantee, but for many people who've experienced trauma, I mean, one of the ways, what do you look for? You look for ways to cope. If your typical coping mechanisms don't work, gee, alcohol might work. I can numb myself out with this. So people pick up a drink, they use a drug. So we see some people who start using alcohol and other drugs as a way to manage their trauma symptoms.
So you mean they're consciously or are they unconsciously using substances to manage that trauma?
A lot of times it's unconscious. It's very unconscious. Sometimes it's deliberate, but sometimes it's, I'm not feeling okay. Oh, this makes me feel better. I don't think it's necessarily, oh, I have had trauma, therefore I drink or use, but I think it's about what can help me feel differently. I don't like how I feel.
And for somebody who struggles with trauma and also has a substance use issue, if you remove the substance use issue without addressing the trauma, what happens?
Usually there's relapse. It's a really interesting thing, and a lot of addiction professionals don't like hearing this, but if you have, let's say, post-traumatic stress disorder and you have an addictive disorder and you treat the PTSD first, the addictive problem gets better. If you treat the addiction first, the PTSD does not get better. And so all these years when we've heard, well, this is primary. Well, this is primary and important, but this piece is also connected. And so now we talk about doing both, working with both the trauma as well as the addictive disorder.
But it's that chicken and egg that in reading your webpage, which is extensively sourced with information that even helped a layman like me to understand these issues, what I was immediately struck with is the chicken and egg approach. I mean, so how does somebody go and get help for trauma and substance use, and how does a professional treat them? Do they treat one before the other, both? How does it work?
Well, number one, if someone is looking for, let's say, a treatment program, whether it was outpatient or residential, you'd want to be in a program that knows how to deal with both. And they will work with you as an individual to see how in depth the trauma work may be in the beginning of your recovery work. Sometimes you do both just right at the same time. Other times there's an acknowledgement of the trauma and you learn coping skills. I mean, think about it. If I've been using alcohol and other drugs as my primary coping skill, and you're taking those away from me because I'm in a treatment program, what am I going to do when I get home? You better teach me some new coping skills fast that are related to my trauma, that help me when I have a trigger or a flashback, or I have to have some new skills.
Tell us about some of those coping mechanisms, some of those skills that somebody needs to help manage their trauma.
Yeah, well, we teach people some very simple things. They're exercises. Some of them have to do with breathing exercises. They're exercises about being in the here and now. Just like you and I sitting here, an exercise would be for me to say to what color the walls, how many chairs are in this room, how many, they're very simple, concrete things. And we have a variety of these exercises that we teach people, and we have them sort of rate, how did I feel before I did the exercise? How do I feel after I've done the exercise? And end up with 3 or 4 that really work well for you. They're different for different people,
But it can be more intensive as well, right? I mean, you talked about some things that somebody can do in their home office or if they're riding a bus or walking down the street. But what about some of those intensive therapies, and how does that work?
Well, there's a misunderstanding. People think that having complete memory is part of the healing process. So you don't really have to work with people to have complete memory of an event. sometimes, the way I was originally trained was that if I was going to work with a trauma survivor, I'd work with them multiple times a day for many years. Very few people get that service, nor do they need that service. And so some of the more intense interventions we really do reserve for when people are more stabilized in recovery. Uh, but the initial work is pretty, you'd be amazed how powerful it is for people to do really simple things.
How about the role that the 12 steps play? Certainly they're integral to recovery for millions of people. Is there an applicability when it relates to trauma?
Um, well, yes and no. I mean, the 12 steps are wonderful tools for living. They're really wonderful. When we come to trauma, there are a couple of problematic areas. One is you can go to meetings for years and no one will ever say trauma. So you might think, well, I guess that doesn't relate to anybody in this room. No, not necessarily. They just may not be sharing it. The other thing, particularly for women, is sometimes going to co-ed meetings. It's that old 13th step. It's not necessarily a really safe place for a newcomer, for a woman. So those are some of the things to think, but there's nothing contraindicated in the 12 steps. A number of years ago, I wrote that little book, A Woman's Way Through the 12 Steps. And many of the women talked about trauma and how they've used the steps with their trauma. So there's nothing contraindicated, but I wouldn't rely on the 12 steps for my trauma healing.
I want to come back to your authorship in just a moment, but just quickly to continue on this train of thought, what about the role of medications? Is there pharmacology that applies to addressing trauma?
Well, it depends on the person. What happens for people who are trauma survivors, sometimes they have anxiety disorders, sometimes they're depressed. There are a variety of mental health symptoms that often are related to trauma. And sometimes those need to be medicated in order for someone to sustain the recovery or be involved in a group process. So there isn't like a pill you take for trauma, but there are things available for some of the symptoms that are related to having a trauma history.
You've been intimately engaged in this issue of trauma and helping women and men heal from it since the 1980s, and in your books and in your lectures, in your presentations, talk about the evolution of our field, and particularly the evolution of your perspective as it relates to identifying, recognizing, and treating trauma from the 80s to now.
Well, in the 80s, as I mentioned, when I would talk about this in a lecture talk, people were angry at me. Furious. I would come off a podium and people say people were going to die because of what I was saying. Just all these things that weren't true, of course. And then probably one of the most sort of touching things was in the middle to the end of the 90s, a man who two men actually who really were adamant, high up in the field, about why I was wrong. We were all at a conference and they both gave up and gave part of my introduction. They both said they were wrong, that they had been unwilling to look at this, and that's a big deal for somebody to get up if you're a name, and they admitted they were wrong. So it's been an evolution. Now, I would say in the 90s, we began to sort of acknowledge it, but didn't do anything about it. Oh yeah, our clients often have trauma. And then now, what's been evolving slowly is people realizing that becoming trauma informed, understanding trauma is absolutely, I believe, an ethical issue for treatment providers. That it's really important that they understand trauma, what this means in their clients' lives, and then how does that relate to their history of addiction, which is different for different people. But to ignore that, I don't think is okay at this point in time. I just don't think that that's good treatment.
So, Dr. Covington, are you suggesting then that clinicians who are in the process of being trained and getting their licenses, that a component of the curriculum needs to include issues like trauma?
Absolutely. It should be in the curriculum for master's level students. It should be in the curriculum for PhDs in psychology. It should be an addiction counselor education. Absolutely. It really, it needs to be there as a critical piece of understanding human behavior. And because it's so pervasive in our society, I mean, I think that's the thing we have to acknowledge, Bill, is that we're not talking about 5, 10, 20% of the population that comes in for addiction treatment. We're talking about the vast majority.
Really?
And yeah, oh, absolutely. Absolutely. I mean, the people with the highest rates of trauma in their lives are the men and women in our criminal justice system. Now, of course, many of them are there because we have criminalized addiction, but many of them are there and they have extremely high rates of violence and trauma in their lives. People who come into treatment for addictive disorders, again, very high rates of abuse and trauma starting in childhood. So we need to understand what this means in someone's life.
Tell us about what you have coming in 2021 in terms of new products and updates to what you've been presenting to the public for a long time.
Sure. Well, a couple of things. We have Helping Men Recover, which we wrote the men's version. We have women with the men's version. We'll have a new edition of that coming out the end of 21. And we'll also have Healing Trauma and Exploring Trauma are two brief interventions for men and women, brief interventions. And I've just rewritten those and expanded those to include the transgender non-binary community. So those are the three new things that'll come out in 2021.
And that transgender component, why is that so critical now?
Well, I think I've sort of made my career, if you will, thinking about being gender responsive, which people talk about it's only women, expanded that to what does it mean with men. But, the binary model isn't the model in today's world. We have to think about gender on a continuum. People express themselves in a variety of ways. And when we don't talk about that and help people feel included in our treatment interventions, how are they going to benefit from what we're trying to offer? So, and this is, again, is a population with very high levels of trauma in their lives. And so it's really important that the interventions reflect this population.
Last question for our podcast. I know a lot of people will be tuning in because they're professionals. They know your work. They want to hear what Dr. Covington has to say as it relates to their professional careers. But I know that we get a lot of people who tune into these Let's Talk podcasts who are struggling mightily in the moment, and they find that connection through a podcast like this. What is your message to women and men, children and families who are wrangling with trauma in their own lives? What's your message for them?
I think what's really important is to understand that there's help, that the challenges that you're facing because of experiences you had, they weren't your fault, and there are people there who can help you. Healing is possible. For many people, they believe, well, what happened in the past. I just have to grin and bear it. Nobody knows, blah, blah, blah. It's not true. Help is available and healing is possible. And there's a very different way to live once you understand what's happened, its impact on you, and then have some new coping skills. It's a new life, really.
Thank you for ending on a message of hope and help and healing. Thanks, Dr. Covington, for your insights and your time. And thanks to all of you for tuning into this podcast. If you liked it, make sure to tell your family and friends, colleagues and fellow travelers to check out our podcast too. And if you didn't like this podcast, shoot me an email and tell me why, what we can do differently. On behalf of my colleagues and the executive producer, Lisa Stangl, we hope you remain safe and healthy and resilient in these challenging times. And remember, it is never too early or too late to ask for help if you or a loved one, a family member, a friend, or a colleague is struggling with trauma, depression, or other mental health challenges, addiction, or substance use issue. As Dr. Covington said, there is hope, there is help, there is healing. It is okay to reach out and ask for help. Take good care. See you soon.